As of today, we've administered 182,267 vaccine doses, 156,501 prime doses, and 25,766 boost doses. Regarding our supply for the coming week, we were notified yesterday that we are getting 48,475 doses to distribute across our state, which should be coming in next week. As a reminder, right now, the priority groups that are eligible to receive vaccine appointments as part of phase 2 of the vaccine plan include healthcare workers, expanded healthcare worker groups, such as allied health fields, general outpatient health services, behavioral health, dentists, etc., first responders, and Oklahomans age 65 plus. If you've been following the CDC's vaccine tracker, you'll see that as of yesterday, Oklahoma is in the top 8 of states for vaccine distribution. We've given out vaccine to 3.9 out of every 100 people. That is the best rate out of all of our neighbors, but we still continue to work diligently to make improvements in that area. While there's still a lot of work to be done, we are making good progress. And I want to express my gratitude to our partners across the state and healthcare professionals who are working so hard to make this happen. This is very much a all hands type of response, and no single agency, no single group is going to be able to pull this off. It requires many partnerships, many collaborations, and a lot of sacrifice. I also want to provide an update on our vaccine supply provided by the federal government. So due to a recent announcement by the Trump administration, Oklahoma is anticipating increased vaccine supply in the coming days. Operation Warp Speed will be shipping first and second doses of the vaccine to states. This is definitely a departure from the procedure that we were aware of as of yesterday. This approach takes the extra step to ensure there will be a second dose available for everyone who receives the first. OSDH received guidance from Operation Warp Speed to expect a larger supply of these doses coming very soon, although we do not know exactly when. With this new guidance and increased supply, the federal government can begin expanding groups that are getting vaccinated, increasing points of access, sharing supply across states as needed, and they will change how they allocate to states to open the vaccine to all vulnerable populations. Basically, their instructions to us were, in 2 weeks, they are going to start providing allocations of vaccine based off of burn rates by the states, which translated, that means the rate at which we get vaccine from the freezer into arms will impact the amount of vaccine we get allocated. This just continues to emphasize the need to quickly move vaccine from receipt to people's arms. All of that is important to ensure that we continue to get more vaccine to take care of our citizens. This updated plan means vaccine doses will be available at a level they haven't been so far. For Oklahoma, this means the opportunity to open up more channels for administration and access points to the vaccines, such as utilizing pharmacies, community health centers, max vaccination sites like we're doing for the pods. These were all recommendations that were made yesterday by Operation Warp Speed, and much are those recommendations that we have already adopted in Oklahoma. There's no time to waste, and our focus remains on getting the vaccine to Oklahomans as quickly and efficiently as possible. Now, we know that the transition to the Biden administration will also likely impact our vaccine supply. As we transition into working with this administration, OSDH will continue to be flexible with our vaccine distribution plan. We will work closely with the federal government to address any adjustments or changes in the approach to our vaccine distribution. So while we're ready to take on and distribute additional supply at this time, it is still difficult to predict exactly how these changes will impact our current vaccine distribution and administration rates. We continue to ask that Oklahomans continue to be patient with us as we work through any new logistics in this approach. Rest assured, we remain committed to getting our supply to all counties across the state, and we are committed to increasing access points and appointments to ensure Oklahomans can receive the vaccine. Our priority is still to get this vaccine in the arms of Oklahomans who need it most. I also want to make mention that we have received some reports of individuals that may be trying to take advantage of some of our citizens by offering their paid services. in order to assist them with getting either an appointment or navigating our scheduler portal, please, we have not authorized anybody to go out and do that. And I want to remind everybody that the vaccine and the vaccine supply is available at no charge to the public. The insurance information may be collected, but that will only be for purposes of reimbursing providers for the administration cost of providing vaccine. And you should not be charged for vaccine or any supplies that go along with it, or be charged for any assistance in accessing a vaccination or appointment. So with that, I will stop and we'll open it up for questions.
Do you mind going over those numbers real quick again at the very beginning? I know we had some interruptions.
I will. Let me go through those again. So we'll start with the scheduler portal. 399,209 Oklahomans have been registered through the portal. Of those, 226,270 are currently in a phase 2 eligibility group. Of those, 10,239 are eligible within phase 1. 30,560 appointments have been scheduled so far to receive vaccine through this scheduling portal. And for administration, we have administered 182,267 vaccine doses. Of those, 156,501 are prime or first doses, and 25,766 are boost doses.
Thank you so much.
Okay, you bet.
Okay, we'll go ahead and move on to questions. Again, if you have a question, just kind of raise your hand in the chats. We'll go ahead and start with Barbara.
Hi, Keith. Thank you so much for doing this. There appears to be some confusion on 211 and their ability to provide assistance for folks who are having trouble. You indicated last week that 211 was a viable option and that basically you're going to be adding personnel. However, 211 says that's not what they do. Can you resolve that issue for us, please?
I'm glad you brought that up. So yes, I definitely want to speak to that. I did see a report yesterday that came out that indicated from 211 that they were not an option for that. We quickly connected with 211 to make sure that we were all clear on our communication. That report did not accurately reflect what our process is. We have anywhere between 35 and 40 people that we have added in as a subsection within 211. So what happens is when you call 211 and and the general public is going to report that they need assistance with vaccines, with the scheduler portal, or just questions about COVID, they are transferred to this group. This is a subgroup that is manned by state health department personnel that is linked to 211. Within that group, they are able to walk through the scheduler portal with individuals. They are able to answer general questions about navigating the system. Now, they are not IT support. They can't get into all the technical aspects. If there is a computer problem, maybe the computer software isn't compatible or some type of very technical issue like that, but they can help walk through issues with the portal. If somebody does not have access to technology to be able to access the portal and to get connected that way, then they are collecting contact information, finding out the county residents, and communicating that back to the county health department of residents through our health department channels, so that at a later time they'll be able to reach out to them and help coordinate those appointments. So we very much do have staff that are dedicated to assisting in that particular area. And 211, we got coordinated yesterday, and I feel that everybody's comfortable now with that process. I will tell you wait times. I looked at the wait times this morning with 211, and our particular group that is assisting, and they're around the 15-minute mark wait time for providing assistance for this.
Thanks, Keith. We'll move on to Catherine with State Impact.
Hi, thank you. I have two questions. So the first is about long-term care facilities. In group one or group two, where do group homes for people with disabilities or inpatient facilities like psychiatric facilities, where do those fall?
So group homes are in Plan B of that long-term care program. And that is, we're specifically talking about the ones that are still on list for CVS and Walgreens to provide vaccinations to. So that's where group homes are. Inpatient facilities, those are in congregate care type of housing. So those would be taken care of a little bit further into our phase 2 group right now.
Okay, thank you for that. And then I had a question from a listener. They wanted to clarify how to get a second dose through the portal. They said that they saw somebody say it is not required to schedule your second appointment through the portal. The portal is intended to be another option for Oklahomans to schedule their vaccine. They're saying that it looks to them like they must schedule to get it through the portal. So I was just hoping for some clarification there. Sorry, I know that was rambling.
No, that's all right. If you can ramble your questions, that means I can ramble my response though. So please forgive me for that. So really there's a couple of issues with that. One is I need to remind everybody that the scheduling portal is linked with our public health systems. So when we start putting vaccine out to primary care providers, those pandemic providers we've talked about, they are not all going to be using that second, they're not all going to be using the scheduling portal for either first or second appointments. They'll use their own appointment system. Those will just be other options that are out there. For some of that confusion that's coming in about some understanding that they don't have to use the portal for that is most likely related to some clinics that occurred last week. If you recall, we didn't have the scheduling portal ready to roll out at the beginning of last week, but we were ready to start rolling out vaccine to 65 plus, and we needed to do that in some of our pods around the state. So last week, many of those were scheduled outside of the portal system until waiting for us to get it rolled out. Some of those sites will use a scheduling system outside the portal to wrap up second doses for those individuals. And then they'll pick up the portal as their routine second dose scheduler moving forward. So that may be why there was a little bit of confusion on that. What I would say to those individuals, if you receive specific instructions from the site where you got your first dose, follow those particular instructions.
Thank you.
Okay, Dylan, KOCO.
Hey, Deputy Commissioner, good to see you again. I have two for you also. The first being, I know we expect some expanded supply from Operation Warp Speed because of this new plan to get all the doses out at once. In your opinion, even that expanded supply, is that enough to get us, on track to where we really want to be, to where we really, a number of doses we really want to be giving out every week? Do you think that'll put us on track?
Well, that's a great question, and a question I wish I had the answer to. While they made the announcement of giving us the second doses, and then they made the announcement of in a couple weeks they're going to change the way they allocate vaccine based off of burn rate, that still doesn't give me clear numbers on what we're going to get a couple weeks from now. It helps me to understand what second doses are coming, because if you think about it, if we're allocated 48,000 doses for this week, at this point they were holding back another 48,000 in reserve to send us 3 or 4 weeks later, depending on what the manufacturer was. So I have an idea of what the boost doses will kind of do to our inventory, but what I don't know is how much vaccine is truly out there and will be provided to us based off of their revised system of allocation. What I want to do is I want to maximize that. As a state, we want to maximize that. We want to get the doses that are commensurate with our ability to put it out to the public. Therefore, we want to make sure that we're pushing vaccine out to the public as quickly as possible and demonstrate to them that we have the ability to do that rapid turnaround. From what they have informed us of, they will continue to make adjustments in our shipment based on our ability to vaccinate. Is that enough to keep up with us and give us what we want? I don't yet know that. Quite frankly, we're going to have to find out. Our plan is to expand our options, to engage our pandemic providers to the level that matches with the vaccine supply we have. And in doing so, hopefully we continue that rapid burn rate and we continue to rapidly turn vaccine from freezer to individual arms as quickly as possible and kind of force them to continue to increase our allocation. But there's still questions out there. We still don't have good numbers and know what we're going to have.
But at this point, you guys can distribute many more vaccines than how much we're getting each week.
So absolutely, we could, if we had incredible amounts of vaccine dumped on us, we could start, and I say dumped on us, that's not a good way of putting it, allocated to us. We can go in the system, we can direct that to our pandemic providers. We have 1,367 pandemic providers around the state that we're dying to make use of. If you think about that, that is over 1,300 points of access around the state that would be in addition to what we can provide through our mass vaccination pods. That's been the strategy all along, is to create large scale, high throughput access points, as well as many, many, many other access points that people have options to go get their vaccine. So yes, we are prepared for large volumes to come into the state. And I would go ahead and put word out to our pandemic providers that have signed up. Be prepared. I can't guarantee you that you will get vaccine in the next week or the next 2 weeks, but please be ready, be thinking about your plans to vaccinate the population you take care of, because if all goes well, we will be engaging all of you very soon.
Thank you.
You bet.
Okay, looking quickly through the comments and questions, it looks like we have some from the public. So I just want to remind everybody that this is a media briefing and we have limited time, so we want to make sure we cover all of the media questions, but we'll take note of the other questions as well and see if we can get back to you after that. So just moving on quickly, K4.
Hey, so I have two questions. The first one is going to be, we've had some messages from viewers who are asking, are we as a state, have we been testing for the variant that we're seeing in some other states? And then if we are, exactly how aggressively have we been looking for that? And then my second question is going to be, you kind of answered this earlier, Keith, but we got interrupted by somebody that didn't have their mute on. But basically, for people that are going to 211 to try to make an appointment that don't have access online, obviously, you guys can't make appointments for them, but are you going to be hopefully doing that in the future, having somebody with 211 that can actually make appointments for people? So those were my questions.
So at this point, the way we're doing that is I would not expect people to go to 211 and expect to get an appointment. They would expect to get assistance, and then we can help identify those that cannot use the portal. The portal will not work for them to get vaccinated. And then we will get their information back to their local health jurisdiction, local health departments that will then reach out to them to help get that appointment set. So that's the manner in which we would want to help facilitate them getting an appointment if they don't have access and the technology is not going to work for them. Regarding the first question you asked, that's really a question for our state epidemiologist and our acute disease service. I will tell you that they continue to work with CDC and their laboratories on evaluating the specimens we have. I don't have any additional information on the rate at which they're testing for that variant, but to my knowledge, we have not identified that variant in Oklahoma at this point.
Thank you.
You bet.
Okay, we'll move to James with KTUL.
How you doing, Mr. Reed? I had two questions. One kind of piggybacks off of what Dylan was asking. So the pandemic providers and such like that, with the new wave of anticipated allocation for doses, is it just that you haven't had the need to utilize those places to get the vaccine out to people simply because we didn't have the doses available? And then my second question is just, they're in surrounding states, they're kind of reaching the point where some of their doses are expiring and becoming wastage. Has Oklahoma reached that point? If so, do you know how many doses have gone, have expired up to this point, and have you guys prepared for that?
Okay, so first question, and thank you for the questions. First question is, it's absolutely been a vaccine supply issue. That's the reason we have not pushed it out. Keep in mind, when we push out doses to pandemic providers, we're getting small increments around the state, and it's not an efficient way to get a lot of vaccine out, but it is a very valuable and useful way for us at the right time of the response. We need to support large throughput clinics, these pods that are out there, so that we can get a lot of people vaccinated very quickly. So it's just a supply issue. That's the reason we haven't really engaged them at any significant level at this point. We have sent out vaccine to federally qualified healthcare centers to try to, basically kind of dip into that program to get it started. And I expect in the coming week or two that we will start looking very strongly at engaging pharmacies as probably that next tier. And then we'll just continue to bring on those pandemic providers as the supply allows. To your question about wastage, no, we're not having any problem with vaccine that is expiring. I can tell you that the vaccine we get in each week, it is earmarked for distribution within the next week. It's hard to tell that on the numbers because there's a constant flow of vaccine coming into the state, but we don't have any vaccine that is sitting on a shelf for any significant period of time. Within 7 days, it is going somewhere, and then something else is coming in behind it to sit on the shelf. The only wastage that we've really seen is just maybe an error in drawing up a vaccine. I'm talking just very small scale issues that you would see in any type of vaccination program where there's some kind of error on with a needle. A needle's bad, the needle is broken, it's separated, it leaks or something like that. So the waste we've been looking at is around single doses in different areas, not any type of scaled wastage at all.
Thank you.
You bet.
Rick with Fox 23.
I had two questions. Can you hear me?
You're a little quiet, but I think I can hear you.
Okay, let me talk closer.
Okay, that's better.
So yesterday, Tulsa Health told me that they were concerned about Health and Human Services or Operation Warp Speed's announcement about the second doses, and they said they want to hold back some doses to ensure that they have enough for the people who need the booster on time. Are you confident there will be enough of the supply that we will get, that people will still be able to get their booster on time?
So a great question, and a question to where we still want a little bit more information to help inform our decision making about how we move forward. But I'll gladly share with you some of the thoughts around this and the considerations around this. As I mentioned, our future allocations are going to be based off of our burn rate, off of our ability to move vaccine from the freezer to the individual. We have been assured that if we are moving vaccine in that manner, that they will continue to resupply us at a rate that will meet our needs for second shots. Now, that requires a little bit of faith in the program, faith in the supply chain, and I understand that that can get somewhat uncomfortable. But we have to be very cognizant of what we are doing with our strategy and how is that going to impact Oklahoma. If we have a strategy of holding back our second doses and just duplicating what Operation Warp Speed has done, then we run into the scenario where we have a slow burn rate and then we ultimately decrease the allocation for the state. So that is not a very good option, right? So we want to remind everybody that while the second dose is scheduled and due for Pfizer on the 21st day, it's scheduled and due for Moderna on the 28th day. And our goal will be to have it available at that time period. If it's delayed by a few days, that does not decrease, the efficacy of the vaccine. It just means that it's going to be a few days before you get that full protection. And that's not ideal. It's not a perfect situation, but not much in this response is perfect. Not much in this response is ideal. And when we go through and look at our strategy to do the best for the most people in Oklahoma, we have to take all factors into consideration. So we still have more information coming in about this new announcement, about the expectations, about what we can expect to come in the way of vaccine. But we are committed to continuing to provide second doses to Oklahomans. We want to provide those as close to the appointed time as possible. But we would also ask for some flexibility if we move through that process. If there's a few days here or there shift, we would ask for patience from Oklahomans, because we're doing what's best for the state and getting vaccines into arms of Oklahomans and stopping the pandemic.
Thank you so much. My second question will be, is with this flood of new vaccine, do you anticipate, we could have 11 p.m. appointments at some of these pods, or weekend appointments, things like that, just opening up more windows, because obviously the schedule does get full with what we have now.
Yes, but let me say something on this. This brings up a great challenge for us. We are looking at shifting and making appointments as accessible as possible, but the public health workforce that we have that are a major part of the manning for these pods, it's a limited resource as well. And we are in the middle of a marathon here. This is not a sprint towards a finish line at the end of the month where I can just work everybody to the point that they can't continue on. We have to conserve our resources. We have to take care of our resources. And I would be remiss if I didn't take this opportunity to thank them for all they're doing. They're working incredibly hard to help meet the needs of Oklahomans. And I know they're highly motivated to do this. They're not the only ones that are doing it either. They are working with partners. And these pods that you see out there, that is not all health department staff. That involves local law enforcement that are helping us with issues like traffic control. It involves our partners at the National Guard. It involves a lot of community volunteers. It involves venues where somebody has volunteered their venue to be used for this facility, which means they can't use it for its intended purpose. There are a lot of factors that go into pulling off these pods, and our ability to have them running 24 hours a day, 7 days a week is not viable. So that's where we had to look at other options and maybe bring other partners on page with us to be able to provide other access points as well. So it's another point where we ask for the public to be patient. We're going to try to address that vaccine supply issue and think beyond the pods and think of those pandemic providers.
Let me just ask a quick follow-up to that. No matter who you bring on board, are you still hoping that all appointments will be made on vaccinateoklahomagov, no matter who you bring on board?
No. So I do want to be very clear on that. Other partners that come on board may use their own scheduling system. And quite frankly, this is a state vaccine portal, vaccine scheduling portal. And to bring all these pandemic providers on board with that particular system is not even feasible because there's access issues, user accounts that have to be set up and all that. And we would not want to impose on our pandemic providers to feel like they had to use our system to do this. Where we can work with partners and use this system to keep consistency, we're going to do that. But we're not going to stop ourselves from opening up other access points simply because of this system.
Thank you.
Okay, Keith, this next question is from Cassie with the Frontier. Her mic isn't working. I'll go ahead and read her question.
Okay.
With the state's high distribution and administration rates, can you talk about what Oklahoma is doing right?
Oh, yeah, I would love to do that. Don't always get that question. So no, thank you for that. It was kind of interesting when I was watching the HHS live stream yesterday when they were doing their press conference, the recommendations that they made to states to increase their rate of vaccination was very much a checklist of what we've already been doing. They made recommendations to open it up to 65 and older, quit waiting to finish one priority group before you bring on another one. Engage in mass vaccination pods, engage federally qualified healthcare centers, and then engage your pharmacy partners. Those first groups, those things are things that we had already done. We had already put those things in motion. The last thing about engaging your pharmacy partners, it's literally on our whiteboard as one of our next steps when the vaccine supply will permit. So I feel like what we are doing in Oklahoma is very much what they were instructing states to do yesterday. The difference is we've already done that, and many other states are doing the same thing. But we know that a vaccination program like this is about more than individual protection. And that's what we want to remind all Oklahomans of. You get your vaccination, that for you, it's about individual protection, and that is critically important. But from a public health standpoint, when we vaccinate a lot of people, we are able to interrupt the transmission of the disease from person to person. We create barriers. That's why it's so important that we do mass vaccination at the same time we do these smaller individual vaccinations. And that's what's created, a bit of consternation with the long-term care program and CVS and Walgreens not moving their program as fast as we want. We want that individual protection for them taken care of, but we also know at the same time, we have to move with the masses. We have to get people vaccinated at a large scale so we can interrupt transmission in the community, which also comes back to help protect them in those long-term care centers. So a lot of difficult challenges. I feel like we're doing a good job getting started, but I want to be very clear. We're not satisfied with the job we're doing. Nobody is sitting back, patting themselves on the back on this. We've got too much work to do. There are incredible challenges coming with this change that was announced yesterday. There's a whole new slew of challenges that come with that, but we view all those as opportunities to improve, opportunities to help Oklahomans, and we're going to take advantage of that. So we're not satisfied. We're happy with what's happened so far, but we're not satisfied that we've done everything right, and we're not satisfied that we're on the right track. We're always looking for ways to improve and do better.
Thanks, Keith. We'll try to get a few more questions answered. Carmen with the Oklahoman, are you still on?
Yeah, my question's pretty quick. So if we're getting about 48,000 doses next week, is it safe to assume that that number will pretty much double when they start shipping out first and second doses at the same time?
Yeah, that's absolutely fair to say. So anytime if they say you got 48,000 doses coming, that means they're going to ship 48 and they've got 48 in reserve. Starting now next week, what we have coming next week, we've been told is just a 48,000. But weeks following after that, our understanding is that 48 would be 96,000. That's correct.
Okay. Corey Jones, Tulsa World.
Thank you. I appreciate it. So I just kind of wanted to follow back on the 211 phone system. It seems like a rather roundabout way to get people vaccine appointments. Information exchanges many hands, and there might be the potential for someone to slip through the cracks or multiple people. So is this just a stopgap until a vaccine gets to pandemic providers, or is the state working on a potentially better or more efficient way to do it for those who aren't technologically inclined or don't have access to the internet?
I think you hit on a very important point. When we have more pandemic providers, that provides a lot more opportunities for people to work outside of this particular system to get vaccinated. So I anticipate the value and utilization of this particular system for those that can't use the scheduling portal will diminish over time as we open up more those pandemic providers. I also want to point out, you talked about it's kind of it goes through many hands to do, but understand that our resources in our county health departments, which is where many people would be directed to normally to try to get these appointments, those resources are mobilized right now. We have pulled them to try to pull off these large scale pods, and they are inundated with calls, the incredible demand. So this was also an effort in order to help support local health departments all across the state who are inundated with calls and unable to meet that need. So this is really about adding capacity to our existing system, and understand that it's not going to be a one size fits all for all Oklahomans.
Thank you. I appreciate it.
You bet.
Brady with KJRH.
Yes, my question was basically answered earlier, actually. Thank you, though.
Gotcha. Paul Bunnies, you still on?
I am, yes. It's just a follow-up thing. Can we get some stats on wastage by OSDH region? We've gotten a couple reports of maybe some issues out in the Panhandle with some doses that have gotten thrown away or lost their time to administer. And then could that be a bigger issue as we go forward with more doses coming into the state?
So I will look and see if I can get some numbers, but I will tell you there was a point where we had, I think it was 40 doses. I'm trying to remember exactly the number. I think it was 40 doses that we had sequestered in the Panhandle, that we had what we call a temperature excursion. And a temperature excursion is where the vaccine storage temperature gets outside of the recommended range. And there was a question about whether we might have to waste that vaccine or not. When that happens, we reach back to the manufacturer and we get guidance on did that temperature excursion or that variation in the temperature, was it enough to impact the viability of the vaccine? So we had some doses there we thought we were going to have to dispose of, and we quarantined it in the freezer. And when we reached back to, in that case, it was Moderna, they came back and said, no, actually, that's within our margin of error. That vaccine is absolutely viable and good to go. I will look and see if I get some numbers on overall wastage, but they're just minor numbers scattered around the state. I can tell you we've had no large-scale issues, and I do not anticipate that we will have any moving forward. We're going to move vaccine fast enough that shelf lives will not be an issue.
Okay, thank you.
Caitlin Mills, are you still on?
Yes, but I think I got my question answered.
Okay, perfect. Jacqueline, I know you had a question for Brent regarding yesterday's announcement. I'm not sure Keith can specifically address school quarantine, but we can get a response back to you for sure on that, if that's all right.
Kevin? Yeah, Brent messaged in that one, so I'll let him know.
Okay, we'll do. Kevin with Telemundo, are you still on?
Yes, I am. Can y'all hear me right?
Yes.
Okay. So I'm looking at the vaccine portal, and it doesn't look like there's a Spanish version. And I've had a lot of our many people from the Hispanic community have reached out to us saying that they can't understand and they're having trouble filling out that portal. Is there are there any plans to create a Spanish version for the Hispanic community as well?
That upgrade is in the works right now. And we recognize that from the very start. So that work has begun. We couldn't get it out quick enough to roll out with the initial rollout. But yes, we are working on that. Absolutely.
Okay. And just a follow-up question. Do we have like a timeline to when, because I know vaccines are pretty limited and appointments are filling up quick. So is there a timeline for that?
Let me check on that and see if I can get back to you, Kevin, on when the projected timeline is for that. I'll check with the team.
Okay. Thank you.
You bet.
Okay, we'll take one more question if that's all right, Keith. Haley from KWCH in Wichita, are you still on?
Yes, I'm here. Hi, Keith. Haley Tucker with KWCH. I am in Wichita, Kansas, but we're almost dead last when it comes to vaccine distribution. So how did you guys in Oklahoma create the pre-registration for people to get in line for the vaccine, and how can other states like Kansas kind of get on that track?
So as far as the scheduling portal we originally were told by Operation Warp Speed that they had a component that would work for us. It was a vaccine administration management system. And this actually delayed our work in getting our system up and running. But when we found out that that was going to be an all or nothing system and offered us no flexibility on how we rolled out the plan, we quickly switched and engaged with the Microsoft team to develop the scheduling portal and really just put some pretty strict timelines on them to get it up and running. But we didn't put all our eggs in that basket. I mean, we knew that we were going to have to just continue to do everything we could to get vaccine into people's arms. That's the reason we started with large scale pods before that scheduling portal rolled out. We just really prioritize getting vaccine to people, bottom line.